We are continuing our discussion on two-way conversations during healthcare appointments. This is part 2 of Sarah Baker's presentation. There has been an increased use of telehealth due to COVID-19, so now we are going to move on to using telehealth to effectively communicate with your healthcare provider. What is telehealth? The use of electronic information and telecommunication technologies to support long-distance clinical healthcare, patient and professional health-related education, public health, and health administration. Technologies include video conferencing, the internet, store and forward imaging, streaming media, and terrestrial and wireless communications. Your appointments, and in some cases procedures, are not face-to-face with your HCP in their office, clinical, or hospital. Instead, you may have phone calls, video conferencing, emails, or MyChart systems. There are many advantages of telehealth, including all of the following. It can be a very effective means to manage routine or chronic care needs. It can safely obtain the above care while practicing social distancing and avoid risk of exposure if you or the people around you are sick. It saves patients time and the cost of coming to an appointment if you live far away from or cannot drive to the appointment. You can still access specialized care when there isn't an HCP locally that can provide it. Many insurance companies cover the cost for the telehealth appointment, but patients do need to verify coverage, as this varies from different types of HCPs, different states, and different insurance companies. Your HCP should provide you with guidance on how to use your device to access the HCP over the phone or for video conferencing while maintaining your privacy. Telehealth appointments can experience communication breakdowns. For example, if they're over the phone, only the verbal channel and some paralinguistic communications come through, but you miss the nonverbal communications. Also, the quality of the audio and video may be poor. It's important to remember for video conferencing to be successful, you need to make sure the background isn't visually distracting, the image and sound are clear and lighting is good, there's adequate speed and connection, that the HCP's standardized telehealth protocols are followed, and that IT staff are available to troubleshoot if staff cannot. Moving on to suggestions and techniques to use during appointments with HCPs. The information on the remaining slides are applicable for face-to-face and telehealth appointments. Here's a reminder from a previous slide that you saw, which discussed various reasons why healthcare communications break down. As patients, we need to work with our healthcare providers to keep the above from happening by doing what we can to facilitate good communication. Facilitating better communication before your appointment. First, try for an early or first appointment. These tend to run on time, and the HCP may feel less time pressure than later into the day, when the schedule may be running behind. When making your appointment, tell the scheduler specifically why you're needing the appointment and tell them if you need time for questions. When going into the room with the nurse, tell the nurse that you have questions or several things you need to talk with the doctor about, and be willing to share those with the nurse. Before your appointment, have a written list of questions and information you want to share listed in priority order, in case you don't get to all of them. Know your history, know your symptoms, when it started, what was going on when it started, what makes symptoms worse, what makes them better, how often you have them. Also be ready to mention anything significant that is not related to your health that has changed or recently changed in your life. Take a list of all prescription medications and supplements with dosages to any and all appointments, even if you expect it to be in your computer record. This information may have been entered incorrectly or not in the past. Consider having a friend or family member with you, especially if you might get flustered. It's good to have a second pair of ears to think of questions you might not. Let's move on to facilitating better communication during your appointment. Did you get interrupted? Research and experience tells us this is likely to happen. Research is being done on how to look at how frequently it happens during an appointment, how long into the appointment before it happens, variation in interruptions between different medical disciplines, and means to reduce or keep interruptions from happening. But even if interruptions happen, patients and HCPs rate appointments as successful if they got their message across. So we all need to do what we can to keep the communication flowing. During your appointment, when asked, "Why are you here today?" or "What can I do for you today?" say, for example, "I have questions about," "I have 3 things I need to talk to you about." And if interrupted, listen to the HCP and decide, is it okay to let them talk? Example, if talking about what you want them to talk about, and then go back to your list, or do you need to say something like, "It is important to me that you hear everything before we start talking so we can make the best use of the appointment time." Speak frankly, honestly, and openly. If you are reluctant or embarrassed to talk, that makes it much more difficult for the HCP to determine what intervention will best meet your needs. Remember, your HCP has very likely heard it all before. If you don't understand something, say so. And remember, we all think we are good communicators, so HCP will assume that they are being understood unless given feedback. If you don't feel like you have been listened to, don't say, "You aren't listening to me." Instead, say something like, "I don't think I have made myself clear. I don't think that answers my question." Often using "I" and wording like the above is a very good way of getting others to pay closer attention to you without being confrontational. Be aware of your own nonverbal and paralinguistic communications. What are they communicating to the HCP? Take notes. HCPs like this, and it can slow us down. Facilitating better communication at the end of your appointment. Say, "I want to repeat back what you told me to make sure I understood and got all the information." This helps both of you make sure that you understand all the important information and what the next steps are before you leave the appointment, what you need to do, what the HCP is going to do. If you feel it will be difficult for you to follow any of their instructions, now is the time to tell the HCP this. Don't go home knowing that you won't be able to follow the treatment plan. At the end of your appointment, if you ran out of time during the appointment and didn't get to everything you wanted to, ask who you can contact and how to do so to cover those. Or discuss appropriateness of setting another appointment to get all your questions answered. Here are some examples what HCPs would like us to ask during our appointments. "I Googled my symptoms and this is what I found. What do you think?" HCPs ask that we then listen with an open mind. "Is there a website you'd recommend for me?" "What should I be doing before my next appointment with you?" "What can I do to prevent this from happening again?" "Why am I taking this medication?" "When should I come and see you again?" Some final thoughts. When communication breaks down, our health and confidence in our HCPs is at risk. Healthcare costs increase and our quality of our healthcare can suffer. While HCPs are aware of communication breakdowns and don't want them to happen, it is our responsibility to work as a team with our HCP to try and keep this from happening. Our health and our healthcare is a shared responsibility between ourselves and our HCPs. Here are Sarah's references for this presentation. And thank you for joining us. And I hope that you guys keep the effective conversation flowing.